Joining us. Well, according to the annual Minnesota Adolescent Sexual Health Report published this week, pregnancy, birth rates, and sexually transmitted infections among Minnesota youth continue a decades-long downward trajectory. Joining us now to talk all about it is Jill Ferris from the UMN Center for Healthy Youth Development. Jill, thanks for joining us.
You're welcome. I'm delighted to be here.
So this is good news for Minnesota youth. Tell us what you guys found.
It is a lot of good news and a lot of trends moving in a direction that we are really happy about. So our report looked at a couple of different trends with pregnancy and birth. We also looked at trends with sexually transmitted infections, and we also looked at some information from our student survey, which is a survey that's done in Minnesota every 3 years with students that tells us a lot of information about what's going on with all kinds of things with their health. And so we looked at different things related to their sexual and reproductive health. So in terms of sort of what the report this year found, we found this year that the pregnancy and birth rates continue to go down. We've had, this has been an issue that's been declining for a long time, which is something that maybe not all of your viewers know. It's not always something that people think of when they think of teen pregnancy, which is that this is going down. But the teen pregnancy rate has actually gone down just 6% just in 1 year, and pregnancy rates went down 15% just in 1 year. So these are huge decreases just in 1 year. We also saw decreases in the STI rates, which was really great. So we look at gonorrhea and chlamydia rates. Those are the two rates that most affect young people, and those are the rates that went down by 25% actually just in 1 year. And the other thing that we looked at this year was, again, our student survey, our Minnesota student survey, and we see that rates continue to hit historic lows. One of the things that survey asks is about sexual activity, and in 2025, just 7% of ninth graders reported having had sex. And that compares to about 29% when the survey was started back in 1992. So going from 29% in 1992 to 7% of ninth graders today is a very big change in not very many number of years.
Okay, so it sounds like teens are maybe waiting to have sex than they were before, waiting until they're older. I'm curious, you know, you said pregnancy rates are down, sexually transmitted disease is down. What does that mean? I mean, does that mean that teens are having less sex, or does it mean that teens are having more protected sex?
Such a good question. It's probably a little bit of both things. So I think that teenagers are having they're having less kind of sex that we would probably be asking about on a survey. So the kind of sex that we're asking about on a survey is about sexual intercourse, right? And that's the kind of question that we've been asking on this survey for many, many years. Those rates are going down, and they have been for quite some time. And I also think that there are, I think, increasingly expansive ways that young people think about sexuality. And perhaps the questions that we're asking aren't actually totally capturing exactly what's going on in the lives of young people. So I think it's probably something that the adults that care about young people and that are asking these questions can make a little bit of an effort to kind of change the way that some of the questions are asked, so that we are really in touch with and in tune with the pulse of what's really going on for young people.
So we are seeing that teen birth rates do remain higher in greater Minnesota. Talk to me about, along with birth rates, talk to me about some of the geographic gaps that you found in this research.
Yeah, I'm glad that you highlighted that, because I think overall it's something that when I talk about this on a kind of a broad level, it's one of these things that seems generally speaking quite good, and that we're doing well and we're making positive strides. And that is absolutely true. And it's true everywhere across our state. And we also have some pretty stark disparities in Minnesota. Those disparities exist by race and ethnicity, and they also exist by geography. So as you stated, lots of places in our state have higher rates of teen pregnancy and teen birth, sort of the further away that you get from the Twin Cities metro area. And in Minnesota in 2024, which is the most recent year for which we have information, all top 10 counties were all in greater Minnesota in terms of the teen birth rate. So, and those kinds of things really are really underscoring the need for young people in rural areas to have youth-friendly healthcare services and clinics and resources and information that is, confidential and something that they can make sure that they can have access to. Geography is plays a really critical role in how young people in Minnesota in particular access that kind of confidential, affordable, youth-friendly healthcare that we know that they need in order to, kind of have the optimal sexual health that we wish for them.
Did your study look at all about gender identity and sexual orientation and how that plays a role?
Yeah, we did. So the Minnesota Student Survey actually looks at and asks this question. So the Minnesota Student Survey asks the question around gender identity and sexual orientation. And one of the things that was really interesting kind of from the last survey is, just how many young people are identifying in sort of increasingly diverse ways. So about 9% of students in Minnesota have a gender identity that's something other that I would call a gender minority. So this would be asexual, agender, transgender, things like that, questioning, unsure, non-binary. There's lots of response options on the survey. And that's a lot of young people. 9% of our youth in our state are identifying as a gender identity, something other than cisgender. And in terms of sexual orientation, we have a lot of young people that are identifying as something other than heterosexual. So in 2025, it was about 83% of youth identified as straight. So doing a little math, right, leaving us to say about 17% of young people have a sexual orientation that's something other than straight. So these numbers are something that is increasing and something that is kind of something additional that we want to pay attention to. Every time we ask these questions, we want to really pay attention to what young people are telling us about what their identities are so that we can design the best programs and the best information and services for what they're going through right now.
I don't know if you guys saw this with the survey, but did teens talk about access to, contraceptive care and those things? And then so two-part question, did they talk about access to those kinds of things, but did they also talk about, how they're willing to advocate for themselves? Are teens today more willing to speak up about these things and ask questions and seek help?
Yeah. So the Minnesota Student Survey doesn't have a question specifically about what you asked about access. What it does ask is questions around what method did you use the last time that you had sex? And so we do know information from young people about, the different kinds of methods that they're using. And one of the things that we see on the survey is that condom use is really kind of we're at an interesting place with condom use because condom use has actually been declining for a long time. And it's something that I think those of us, of course, who are concerned with sexually transmitted infections and making sure that we are continuing to kind of move the needle on decreasing sexually transmitted infections. Of course, we want more and more folks to be using condoms and barriers. What we're noticing is a trend kind of in a different direction with that. And we're seeing really young people making different decisions about barriers and condoms. And so fewer young people are using condoms than they have in the past. And that's something that I think is a concern for those of us that are, working in the field of sexual health. But I also think that one of the things that the survey looked at this year too was experiences of young people talking with their partners about preventing pregnancy and preventing STIs. And that is something that is moving in a direction that is a positive trend. So more and more young people tell us every year that we do this survey that they are having conversations with their partners about prevention and about being safe. And so those things are good. We're happy that young people, it really appears from these surveys and these studies that they do have more health literacy, that they are understanding a little bit more about where to find good information and to find good resources. And that is also the work that all of us as adults that care about young people we're in the trenches with them all the time, trying to help them navigate all of the resources that are available to them that we maybe didn't have growing up in our generation.
Very interesting stuff, important work. Jill Ferris with the Center for Healthy Youth Development at the University of Minnesota. Thank you so much for joining us.
You're so welcome.
All right, we are going to switch gears after the break. We're going to bring in our very own Pierre New.